Hello, I'm Dr. Mick DeRoyne from Southernmost Foot and Ankle Specialist, and I'd like to talk to you today about diabetes and how it may potentially affect your feet. As your primary care physician has probably already told you, diabetes affects the entire body, from your eyes to your kidneys to your stomach, etc. We'd like to focus today on how diabetes may potentially affect your feet. The first area that we would like to talk about and examine is circulation. Diabetics often get blockages in and around the knee area, which often lead to amputation or sometimes surgery to reconstruct the vessels. Signs of bad circulation include cramping in the calves when walking. Sometimes people with diminished circulation develop cramping in their feet at nighttime. The way we check the circulation during our examination is we basically first off feel for your pulses. Here's a foot model. One pulse that we check for is on the top of the foot, is right here, and the second pulse that we look for is behind the ankle. If we're not able to feel the pulses, we have a machine called a Doppler, which I'll demonstrate in a minute, which is a way we can painlessly assess the circulation. Also during the examination, we check how fast your toe pinks up after we squeeze on the capillaries. Signs of bad circulation would be a delay in the return of the color to the toe after it is squeezed. Also, we check for signs of hair growth on the toes. Signs of bad circulation would be absent hair. This is a Doppler machine. This allows us to assess your circulation by listening to the sound the blood makes as it flows through your artery. This is painless, and a printout can be made so we can compare examinations from year to year. And I'll demonstrate this on my arm. That's the sound that the blood makes as it flows through the artery. This is an example of a patient that has gangrene of the big toe. Oftentimes, problems like this can be prevented by regularly scheduled examinations. The next area we'd like to talk about is a condition called neuropathy. Peripheral neuropathy is a disorder of the nerves commonly seen in diabetics, typically diabetics who have had the disease for 10 years or longer, or who have had poorly controlled blood sugars. Typically starts in the feet, sometimes it extends to the hands as well. Signs or symptoms of neuropathy would be numbness, tingling, burning sensation, typically at nighttime. In order to check your nerves or check for signs of neuropathy, there are several ways we do this. We can check your reflexes with a neurohammer, check your sense of vibration with a tuning fork, check your sense of light touch with a wisp of cotton, or your sense of sharp and dull with a pointy instrument such as this. Most importantly, there's a device called the Weinstein monofilament, which enables us to check for your sense of protective threshold. What this means is if you're able to feel this filament bending on your toe, then we're fairly certain that you would be able to feel a pebble or a rock or other type of foreign object in your shoe. Oftentimes, diabetics with peripheral neuropathy lose that protective threshold and are unable to feel foreign objects in their shoe. This can lead to infection, ulcerations, or open sores, and potential problems in the future. Oftentimes, patients that have peripheral neuropathy and get infections often wait until the symptoms are so severe that there's a serious problem. This is an example of a patient that developed an ulceration secondary to not being able to feel a callus developing and pressure in their shoes. If the patient was able to feel, they would have sought medical attention sooner when there was simply a painful callus instead of waiting for an ulceration to happen and become a more serious problem. Patients that have neuropathy that is painful, there are several treatment options available. There are two different topical creams that are available. One is called capsaicin, which is derived from hot peppers. The second is doxepin. Both have had some success in treating painful neuropathy. Also, you may be a candidate for either amitriptyline or Neurontin, both of which have also been able to treat this condition from an oral standpoint. The third area we would like to discuss today is infection. Diabetics are more prone to infection than non-diabetics. The cells in your body that fight infection are called the white blood cells. In diabetics, the white blood cells are unable to get to the site of infection as rapidly and are less effective at engulfing and killing the bacteria than in non-diabetics. This is secondary to elevated levels of the blood sugar, and infection actually can cause an increase in the blood sugar, so this creates a vicious cycle of infection and rising blood sugars. It is important, therefore, that if the skin is broken or you get a cut or a scrape, that you seek medical attention. The skin is your body's first barrier against infection. One of the most important things regarding diabetic foot care is prevention. A lot of the potential problems, ulcerations, infections can simply be prevented by annual diabetic foot screenings for patients that don't have neuropathy or signs of peripheral vascular disease, as well as by home maintenance by the patient. You should always keep your blood sugars in good control and take your medications as prescribed by your primary care physician. You should always wear shoes and socks, particularly in the house and outside. Another thing that's very important is to check your socks every day for drainage. If you're unable to look at the bottoms of your feet every day, a simple trick is to take a mirror such as this one, lean it against the wall, and use that to check the bottom of your feet. You should wash your feet thoroughly with soap every day and dry carefully in between the toes. Another helpful hint is to use some lubricating cream on the feet every day. However, don't put it between the toes. This is an example of a diabetic shoe. These are very helpful for patients that have peripheral neuropathy or have bad circulation. Basically, diabetic shoes have a wide toe box up front to accommodate any hammer toes or bunion deformities that you may have to prevent blisters and pressure and callus formation. This particular shoe has the ability to stretch to accommodate any shape of your foot. This particular model does have Velcro and laces. These shoes typically have a very thick sole to prevent injury from stepping on objects such as a nail, etc. Diabetic shoes come with 3 sets of very soft, accommodative, cushiony insoles. We heat mold these to your feet so that they accommodate all the lumps and bumps on the bottom of your feet. And they also have several different types of material to help them last slightly longer. However, we recommend that you change the insoles from these diabetic shoes every 4 months. Patients with diabetes that do not have risk factors such as neuropathy or bad circulation should have an annual diabetic-related foot screening by their podiatrist annually. For patients that do have risk factors such as bad circulation, foot deformities such as bunions, hammer toes, or peripheral neuropathy, should have periodic foot examinations which include trimming of corns, calluses, as well as trimming of the toenails. This is typically done every 2 months or so. After our examination today, we will discuss with you whether you are a candidate for annual diabetic foot screenings or for continued diabetic-related foot care every 2 months. Prevention can also obviate the need for amputations, loss of limb, loss of life. So it is very important that you take your diabetes very seriously, particularly as it relates to your feet. Thank you.